Hello everyone, this is Shinsi from Nursing Manthra. In today's video, we will discuss how to select the answer for NCLEX examination. Tips for passing NCLEX examination. So in NCLEX examination, there will be alternative format questions will be there. You will encounter so many types of questions like SATA questions will be there. Select all that apply. Multiple response will be the answers. Then hotspot, fill in the blank, charts or exhibit items will be there, drag and drop items will be there. For new generation NCLEX case scenario case studies will be there, and under that six questions for each case studies will be there. So whatever the questions, you must have a thorough knowledge about the content. Whenever you are getting a question, first tip you can practice, that is break it down. Read the stem in the sense of the scenario of the question and figure out what is the problem. Read the stem and figure out what you are supposed to be worried about. Even if everything sounds great, what thing you have to worry about in the question. What is the worst thing that can happen in this scenario? If they are giving some like example bleeding, hemorrhage, accident and all, if they are giving some scenario like that, what is the worst thing that can happen in this scenario? That patient will go for shock like that. Once you have got an idea about what is the problem is, then select answer that fixes problem. Then only you have to check what they have asked for you to do. Okay, maybe the intervention, okay, anything, assessment, intervention, planning, anything can be asked. So in this example we can say a patient came to the emergency department with the accident, but the patient is bleeding continuously. Okay, so the problem is hemorrhage, and what is your intervention in that? There will be so many options, so 4 options will be there. Maybe they will provide sometimes assess the vital signs. So that is not the priority if the patient is in a hemorrhage. You have to take the appropriate measure to stop the bleeding. Okay, so that is the priority. So your answer should be the measure to stop hemorrhage. Like that you have to break it down the questions. That is first tip. Second tip, trash the items. That means look for the answers that you know these 2 options are wrong. I am sure that it is wrong. So just initially itself, after reading the question, then going with the answers, you know that 2 options are completely wrong, you just avoid it. Then focus on the remaining 2 items. Okay. Third tip is, if you don't know what to do, what we have to do, if you don't know what is the answer. So I think this strategy it is going to help you. Like you have to imagine you are in the bedside, okay, bedside scenario, you are in front of the patient, you can see the patient with that condition. Whether I have any idea about what I am supposed to be worried about this patient, okay, and you have to read the answers for a tip off, you might find the answer in that. Okay. Then if all else, even if you are imagine in front of you the patient and thinking that you are treating the patient, all these things, it fails means pretend each answer is written on a separate index card. Okay. Then select which answer sound the safest as an independent statement all alone, which is independently all 4 options. Okay, 4 options, you will get some clues from that options. Okay, to avoid the wrong answers like that. Okay, each particular sentences, which one is okay, like that, the safest you think that which is correct one, that one you can select. So it is safer to pick a nursing answer. Okay, because this NCLEX test is about what the nurse think or what the nurse does. It is not the what the other healthcare team members are doing, or what the doctors has to do, or what the attenders has to do. It is not like that. The NCLEX exam mainly focus on the nursing answer, what the nurse has to do. Select the answer which the nursing responds in the options. So when you have the answer such as call supervisor, call dietitian, you have to be suspicious, because NCLEX would prefer you to do something. okay, to help the patient directly. So, not always these questions correct, but sometimes we have to inform the doctor after the procedures we have done from our side. After that there is no other option, you have to call the physician. But immediately just call the physician or inform doctor or inform dietitian or inform physiotherapist, like that do not select that answers, because always NCLEX tries to you do something for the patient. Then you have to make sure that you have done the proper assessment has been done first. In scenario assessment done means then your answer will be the nursing implementation. Always we have to assess the patient first, that is important, but in the question sometimes the assessment already done. We can say that nurse, you have assessed the patient and you have seen all these things. Then what is next means do not select assess vital signs or any second time also assessment, no need in the answer. You can do directly go for implementation. That is another thing, okay. So, do not pick answers that refer your client away from your care. Do not give your work to someone else. You can't give to the other LPN or like that, okay, LVN and all. Stay away from restraints. If some questions it is asking whether to restrain the patient, wheelchairs, or how to give the drugs, especially invasive drugs and all. So, NCLEX does not like nurses who tie people down or nurses who run to the medication cart for every little thing. So, whenever you are in the options, if you are noticing that restrain the patient, if any psychiatric patient, okay, and making problem and everything, do not select the answer immediately restrain the patient or sedative, provide the sedative medications and all, okay. NCLEX, they do not like nurses to go back of the medication immediately for like each and everything, or restraining the patient, okay. If there is order for restraining, then only we can restrain, otherwise immediately some other options will be there, okay, to select. Then we can follow the Maslow needs, okay, that means the priority wise which one we have to select. Always whenever we are seeing the patient complains of pain, okay, pain is not dealt immediately except chest pain, okay. In MI, myocardial infarction, chest pain, that is very important, we have to take care of that pain. But other pains, whatever the patient is saying that this much pain and all these things, please note that in the questions they can add with the pain, okay, they will give patient is crying, shouting and pain like that, but there will be another problem which is life threatening to the patient. Okay, that is very important. Maybe patient is going for shock, or there is bleeding is there, or it is life threatening conditions are there, that we have to give more priority, not to the pain. So, with the pain nobody will die except the chest pain, okay, that is MI pain. But in the question it will get confused. You suddenly you will answer that you have to administer the pain medication. So, always think, okay, pain is not that much important, we have to consider. So, check the answers which is life threatening cases, okay, life threatening problems in the options. You have to select that option. If that is not there, then you can select the pain option. You will score more points with the physiological answers than psychosocial answers. Then in the stem of the question, there is no indication of a breathing problem. Do not select an answer to help breathing. Okay, so in the question they are not mentioning anything like a breathing problem is there. So, no need to elevate the head and nebulization like that, which will increase the breathing, like that options no need to take, okay. Then call the physician answer. Be careful of this answer, just to make sure there is not a nursing answer. You can select that will help the client or problem first prior to selecting this answer. You have to see the patient, you have to assess the patient, do from your side whatever you can do. After that only you can call the physician if it is really that much important thing, okay. Medication fixation, that means drug plus side effect, there will be problem will be there. So, do not be afraid to select answer that says sit with the client, okay. You can always select sit with client or be with the patient, that is you are assessing for the side effects. If it is safe, consider to be reasonable option. You have to worry about patient with which is given on you, that means in your screen the patient you have to worry. Don't think that you are in emergency department and you have so many other critical patients. Don't think related to any other cases. So, if time permits, you can sit with the patient, because in your screen what patient details it is that is your patient. Okay. So, you can select sit with calm, relax, calm environment, okay, like that, or asking the questions with the patient, like that questions answers you can select. Most of the time like that options it comes. Go ahead and assume the worst client outcome and select the answer that is most life threatening. Then if any patient complains, what you have to do means you have to assess the patient first, and next only equipment. Always you have to check the patient, assess the patient. If patient is okay, then only you can check the equipment. That is very important when you are answering any type of nursing exam. So, that means treat the client, not the monitor. Okay. Priority means any priority question. If I don't do one of the following, my client could die or experience harm. So, in all the priority questions, nursing priority is there. If you are not giving this treatment, patient is going to die. Okay. So, patient will get harm. So, like that you can select the priority answers. Check airway, okay, breathing, circulation, like that you have to. Not airways will not be always will be the first as priority. Okay. Sometimes for a patient has given the artery and all, it's continuously bleeding is there, means to prevent the hemorrhage, that is very important, patient will go for shock. So, okay, in that case not check airway, that is not the important one, there is stop bleeding. So, that is the answer. Like that you have to think clearly and imagine in front of you some patients are there, and critical thinking skills. NCLEX is checking your critical thinking skills. When you are practicing a lot of questions, it will be easy for you to understand each and everything. Okay. So, if you are lack of theory knowledge, don't worry, Nursing Manthra helps you to get proper theory knowledge and questions practice. I wish all the best for your NCLEX examinations. Select your package now and get started with Nursing Manthra study materials. You can contact us through WhatsApp number.